My name is Sujit Chana. I'm the chair of the board of directors at Care for the Homeless. I want to welcome you to today's seminar, Ending Homelessness in New York City, Where Do We Stand? Care for the Homeless is a provider of healthcare, shelter, and social services for individuals and families experiencing homelessness in New York City. We also advocate for policies to prevent and end homelessness. A key part of our mission is to prompt discussions about important policy issues that impact the individuals that we serve. We achieve that by conducting several public education events throughout the year, and this seminar is an essential part of that effort. Convening advocates, service providers, academics, elected officials, and people with the lived experience of homelessness gives us a platform to discuss solutions, both short-term and long-term solutions. We're very lucky to have assembled an excellent panel of experts to engage in this effort today. So thank you for joining us. We hope that you will find this to be a rich discussion. I would now like to turn it over to the President and CEO of Care for the Homeless and moderator for today's panel, Mr. George Nashak.
We are fast approaching the next municipal election in New York City, an election that will yield a new mayor, a new controller, and at least 35 out of 51 new council people. This is therefore an opportune time to consider what homelessness policy issues need to be prioritized by the next class of city leaders. What has worked towards the goal of reducing homelessness? What has not? And what remedies will effectively address the inequities that have contributed to the current crisis? One point on which there is broad consensus is that ending homelessness will require a multifaceted approach that prioritizes access to adequate healthcare, stable housing, and enhanced support services to help individuals and families experiencing the trauma of homelessness to achieve stability. This approach requires the coordination of social service providers and government entities to ensure that the interventions are targeting the correct issues and are managed to successful outcomes. The goal of our discussion this morning is to contribute ideas for short and long-term solutions that we believe should be considered by the incoming administration. What would a comprehensive agenda to end homelessness look like? We also want to raise the possibility that the COVID-19 pandemic has provided new opportunities to rethink how we can provide services to the thousands of households dealing with unstable housing. Can we avoid letting this crisis go to waste? I ask our audience members this morning to please submit questions for our panelists through the Q&A function that I'm sure you're all by now familiar with. We are also always seeking ways to improve our policy seminars, and so we ask you to complete a short survey at the end of the program. We value your feedback, and we have incorporated into our planning many ideas suggested from audience members in past surveys. We will shortly be displaying a poll, and we ask each of you to choose 5 policy issues that you believe the next mayoral administration should focus on. We will repeat the poll at the end of the seminar and learn whether the presentations you are about to hear have changed your priorities. It is now my great pleasure to introduce our panelists. We invited each of our panelists based on their experience in a particular area of homelessness policy. I think you will agree with me that this is a truly outstanding group of experts, and we look forward to hearing their perspectives on our questions this morning. Let me begin by introducing Dr. Kelly Doran, who is assistant professor in the departments of emergency medicine and population health at the NYU School of Medicine, where she directs the Health by Housing Lab. She also works as an emergency physician at Bellevue Hospital. Dr. Doran attended medical school at the University of Michigan, completed her emergency medicine residency at NYU Bellevue, and earned a master's degree in health sciences as a Robert Wood Johnson Foundation clinical scholar at Yale. Dr. Doran's research on topics including homelessness and substance use is funded by the National Institutes of Health and the Centers for Disease Control and Prevention. Next, we have Karen Ford, the Chief Operating Officer at Help USA, where Karen directs the operations of more than 1,000 staff at 32 homeless service and prevention sites. Karen has served her community for more than 30 years, from her early days as a residential aide at DHS and a youth and family services administrator at the New York State Department of Health, to her role as Deputy Commissioner of the Department of Homeless Services before joining Help USA. Rangi McNeil is a distinguished poet whose work has been published in the Sheep Meadow Press, the Song Cave Press, the Bennington Review, and the Paris Review, among many others. He has led creative writing workshops at Bank Street College, Borough of Manhattan Community College, Columbia University, and he recently received funding from the New York City Artist Corps to conduct a series of workshops with individuals residing in homeless shelters. Rangi also brings with him firsthand knowledge of what it means to experience unstable housing in New York City. Frederick Shack is the Chief Executive Officer at Urban Pathways. Under Fred's leadership, Urban Pathways has developed more than 800 units of affordable and supportive housing, including the construction of 9 buildings in Manhattan, Brooklyn, Queens, and the Bronx. Prior to joining Urban Pathways, Fred spent 14 years at Help USA as Senior Vice President of Client Services and Public Policy. He's a field instructor for social work interns and a senior lecturer at the Columbia University Graduate School of Social Work. Felipe Vargas is the Vice President of Programs at the Doe Fund, which provides housing, paid transitional work, and holistic programs to thousands of formerly homeless and incarcerated men. Felipe leads the organization's direct service design, management, and oversight. Before coming to the Doe Fund, Felipe held leadership positions at Acacia Network, the Exodus Transitional Community, and the City University of New York. He brings over 2 decades of experience serving individuals involved in the criminal justice system. Please join me in warmly welcoming these extraordinary panelists. Let me begin with Dr. Doran. Kelly, you have a unique perch from which to observe the trajectory of homelessness in New York City over the last several years, the emergency department at Bellevue Hospital. What insights can you share based on the people you have met and treated? Where is the homeless services system working, and where is it failing to address the needs of your patients?
Well, thanks so much, George, and everyone, and thank you for having me today on this panel. I'll have to start with the caveat that in the emergency department, we tend to see more of the failings than the successes. People don't usually come through our doors when when things are working out particularly well for them. So that caveat said, I'd note 2 main things that we're seeing in the emergency department that are somewhat concerning. The first is that in addition to seeing a lot of homeless patients in general, we're seeing more and more people who are elderly and homeless. I first started working at Bellevue back in 2007, and it used to be that it would be rare for us to have a patient who was homeless and older than 60. But now it feels like regularly, like every one of my emergency department shifts, seeing patients who are homeless who are 60 and older, 70 and older, even sometimes over 80 years old. And some of them have been homeless for a while, but many of them are in their first episode of homelessness. And a few years ago, some research colleagues, including Dennis Culhane and myself, together with the New York City Center for Innovation through Data Intelligence, did a study of this nationally. And we found that there is aging and homelessness across the country. And we put together a report with several policy recommendations. It's online, but there's still really big gaps for this group that we're seeing on the ground. And I'm especially worried because we have a group of like older people who have multiple medical conditions who are quite frail, and there's really not a perfect long-term option for them right now. The second thing that I'm seeing in the emergency department is that many of my patients are unsheltered and they don't want to use the shelters. A lot of them have tried the shelters before and they won't go back. And they generally give me, pretty reasonable reasons for not wanting to go, including being concerned for their safety, lack of autonomy, feeling disrespected, issues with being able to bring their stuff or their pets or their spouses. So I see a lot of patients and I ask all of them actually, do they want to go to the shelter? And I'm at Bellevue Hospital, so we're literally next door to the men's intake on 30th Street. And even still, they don't want to go, and they give pretty good reasons for not wanting to do so. So we've seen some good strides, including during the pandemic, things like increasing safe haven and stabilization beds, including using hotel rooms. But still, the main option we have, at least on the ground in the hospital side, is through the mainstream shelter system that many people don't want to go to. But, last I'll flip the question around. You asked about failings in kind of the homeless services system, and I want to acknowledge that there are failings in the healthcare system here that are pertinent too. So, in our general healthcare push to kind of move everything outpatient, that sometimes leaves out people who are homeless in terms of being able to access those types of services. And also what we see when people are hospitalized is that too often they're discharged right back into homelessness, sometimes back onto the streets. And this really shouldn't be happening as much as it does. And I do think that we should hold hospitals more accountable for what happens to people after they leave our doors. We have a big unmet need for medical respite in New York City. That's hopefully getting better with some changes that are happening on the state level. And then last, I'll say, we have some missed opportunities for doing things in hospitals, like collaborating more with street outreach teams, helping people with their supportive housing applications and other housing options, and in general, making people feel welcomed and like they're not facing stigma in our healthcare system for being homeless.
Thank you for that. And thank you especially for those of us who work in the shelter system and with folks living on the streets. We're grateful that someone recognizes the role that the healthcare system plays in that. And I think that's an important piece of the discussion. I'm going to pause before asking Dr. Doran the next question, because we want to show you the poll in which we're asking you to choose 5 potential policy choices that we would encourage the next mayor and administration to continue. We'll leave this up for a few minutes. And as I said earlier, we'll repeat this poll at the end of the seminar to see if there have been any changes in the way that people answer the poll based on listening to our panelists this morning. So while you're doing that, I'm going to move on to the next question for Dr. Doran. Over the years, there have been a number of attempts, including at Bellevue Hospital, to identify frequent users of emergency departments and homeless services, and to prioritize people for enhanced services in an attempt to break the cycle of homelessness. In your experience, is this targeting approach productive? And if it is a productive approach, why haven't these programs been sustained? What would you advise the next mayor and DHS commissioner to invest in with respect to targeted services?
Oh, I'm fixated on the poll and watching these numbers, but for frequent users, I've been involved in some of these initiatives in the past myself, research projects and otherwise around frequent emergency department, people who use the emergency department frequently. I guess I'd say first, like just to put it out there that, I think that all people who are homeless need housing, and it doesn't really matter how many emergency department visits they have or don't have. I think the thing that makes me worried about, for example, prioritization or targeting schemes based on emergency department visits or really anything else is that we don't have great knowledge or research to show what types of prioritization is best. And, there's a concern that some people can be left out. Personally, I tend to prefer thinking about trying to match a given person to the right levels of services in terms of what they need. I mean, everybody needs housing, right? And I think the question around prioritization is often based in this kind of scarcity mindset that would be good to be able to get away from. All of that said, I do understand, why certain hospitals and the healthcare system want to focus on people who are frequent users of healthcare. I should say, by the way, that oftentimes we talk about frequent emergency department users, but compared to an inpatient hospitalization, emergency department visits are like an order of magnitude less expensive. So when you're looking at really the most expensive people to the healthcare system, it's really the folks who are being hospitalized often. So I can see why the healthcare system wants to focus on them. I think the place where I've found looking at frequent hospital use most useful is really just getting the attention of the healthcare system so that they can try to bring something to the table too in terms of what they can do, like developing medical respite programs, or some healthcare systems around the country have actually contributed funds towards building supportive housing. But overall, I think even though I've done a lot of early work on frequent emergency department use, I feel like we've gone a little bit too far on down that path, and we might need to rein it back a little bit. For example, I don't think that emergency department use should necessarily be like front of mind for the homeless services system in determining priorities. And on the other hand, it's also pretty clear that while the healthcare system does have a role to play, it's really not going to be the primary system to end homelessness. It's part, and it needs to be a partner. But kind of putting all our eggs in the healthcare system, fixing frequent users thing, I don't think any of us think that that's going to be like the main driver of ending homelessness in New York.
Thank you. A final question, Kelly. The disparities of access to high quality healthcare faced by people experiencing homelessness long predate, as we know, the COVID-19 pandemic. But perhaps the additional attention the pandemic has brought to this problem has created an opportunity to create and deploy more robust solutions to the problem. Can you identify one or more policy priorities for the next administration to address this issue, particularly given the context of what we've lived through in the last nearly 24 months?
Yeah, and we've lived through a lot, and not to be too flip about it, but like I think the number one thing I want the next administration to prioritize is really ending homelessness, dramatically reducing homelessness in New York City. I think from the healthcare side, the pandemic has shown, if it wasn't already clear, and it pretty much was already clear how compatible homelessness is, the state of homelessness, right, with keeping people healthy. And we've also seen some of the health downsides during the pandemic, specifically when you have a system that is relying on having tens of thousands of people in congregate shelters and thousands more people on the streets. I think we could think about good specific ideas to come up with in order to provide better healthcare for people who are homeless. And there are some good examples of that happening here in the city, generally on relatively small scales. But truly, from a health perspective, I think the best thing we can do for people's health is to make them not homeless anymore. And I think that necessitates a housing focus. Substance use alone doesn't cause homelessness. Mental illness alone doesn't cause homelessness. Health problems alone don't cause homelessness. All of those things only cause homelessness when they're put on this backdrop of scarcity and affordable housing options for people. So I'd really like to see all of our other efforts, including efforts within the healthcare sphere, not losing sight of that end game of housing-focused solutions for ending homelessness.
Thank you for that perspective, Dr. Doran. Karen, I'd like to turn to you. The census of the family shelter system decreased significantly over the COVID-19 pandemic. No one truly knows whether this is a temporary effect of the pandemic or whether this is a real structural shift in the demand for shelter and the effectiveness of DHS policies. What opportunities does this reduced census create for the next administration? What can the next mayor and DHS commissioner do to ensure that the census remains low or perhaps even falls further?
Well, good morning, George, and thank you for inviting me to participate in this timely and panel discussion. Hello to this esteemed panelists and our consumers and our colleagues. Yes, George, it is absolutely wonderful that the number of families in the system continues to decrease. Over the past 6 years, the family system census has declined by approximately 55%. In 2016, there were 15,000 families, and now we're down to about 8,611 families in our shelters. While we still have a way to go, and I don't want to say that we've completely arrived, I do believe that the intentional and focused efforts of this administration is the reason for the decline. There are several system changes that I believe are of note and have had a positive impact on the system. The most important and notable change is in the paradigm shift that has adjusted our lens in which we view homelessness. The administration publicly recognizes that this present state of homelessness is really a result of years of housing segregation, thereby a failure of the system, lack of access to affordable housing, poor quality education, and the systematic production of generational poverty. So the ability to devise solutions from a racial and social justice lens has produced 3 effective interventions that I believe should remain or be expanded upon. First, in 2017, New York City was the first in the nation to pass legislation requiring legal assistance, a right to counsel for tenants in housing court. An analysis by the Community Services Society found that between the period of 2017 and 2019, evictions decreased by 29% in neighborhoods protected by the right to counsel. And 84% of the families represented by the New York City Council of Civil Justice Attorneys in court proceedings, they evaded evictions. Second, we know that home-based has proven to be a highly effective homelessness prevention model. Help USA and a few of our peer organizations were among the first providers to implement the model in 2004. There have been several studies that prove the effectiveness of providing counseling and case management support, mediation services, housing court advocacy, and most of all, financial assistance helps to reduce homelessness by approximately 24%. We are also a part of a Bronx-based consortium participating in the emergency rental assistance program that prevents COVID-19 related evictions. So throughout this administration, there was an increase in funding and citywide expansion of access to home-based services. Under the leadership of our senior VP, Danny Farrell, we serve approximately 5,900 households annually throughout 3 locations in the Bronx. We are part of again, I mentioned the consortium, and we are well prepared in the system to prevent households from entering the shelter system. Third, the expansion of a variety of housing vouchers, which I know we'll get into a more in-depth discussion further in the conversation. But the next administration must continue to expand homelessness prevention policies and funding that are at the center of our fight for housing as a human right. Access to legal protection, case management, financial assistance, and expanded voucher options are the key to reducing family homelessness.
Thanks, Karen. Another question that has been on a lot of people's minds is that the COVID pandemic really brought into high relief disparities of access to technology and healthcare for homeless families. We all saw stories about kids living in homeless shelters having difficulty accessing Wi-Fi to do their schoolwork. These disparities place children in shelter even further behind their peers in learning and developmental milestones.
Yes.
This was not a result of any characteristic of the child, right? This is simply by virtue of the fact that they were living in a shelter. What must the next administration do to ensure that children in shelter are given the resources needed to excel?
Oh boy, George, the onset of the pandemic was a very difficult time for all of us, and it still is. We're not out of the woods yet. We're still navigating several changes to the system. The sector was challenged with ensuring the health and safety of our staff while continuing to provide much needed support to our families, particularly around technology and healthcare. When the city was forced to shut down and move towards remote learning, Help USA, BronxWorks, Canva, and a few other providers immediately mobilized and obtained the financial resources to install internet access in every one of our facilities. The need for access to Wi-Fi became radically necessary for access to medical telehealth supports, as well as in-person healthcare was scarce. And in some of our families, a lot of them, we are deficient in the provision of on-site medical care. So in the battle against poverty, we know that education is the first line of defense. There are several studies from our partner organizations like Advocates for the Children and the Samuels Group, which includes the Attendance Matters Project, that reflect the true value of what I call, and we all know this, right? It takes a village, and it really does, take a village in order to raise a child, in providing extra support to families to ensure that children with attendance problems get to school, that they can have life-altering impact on the well-being of that child. Many of our students come into the system with educational deficiencies already. Chronic absenteeism and developmental disabilities. There are studies that can prove that chronic absenteeism is a sign of housing instability. So when we continue to use our racial justice lens and see housing as a human right, then access to internet, high quality healthcare, and educational support reflects these values. So the next administration would really need to support program staffing models that can meet the salary requirements to attract and retain clinical and generalist social workers, i.e. client care coordinators that are already infused in our system to provide clinical support and developmental support. For the first time in our system, we can determine baselines for individuals that require these types of services. They will also need to provide fund staffing patterns and or collaborative efforts that provide quality educational supports to our families. We continue to strengthen and support the collaboration of DOE, Department of Education, and DHS in its focused work on supporting students in temporary housing, the Bridging the Gap social workers, and expanding access to opportunities to the new Learning Bridge educational supports that the city implemented over the summer, including placing the families in shelters that are near the youngest child's school. So the new administration, it must be intentional, George, about building a bridge to city resources to support survivors of domestic violence and intimate partner violence. At least 30 to 40% of our families enter the system by way of bypass from DV shelters because of the time constraints. The family enter our DHS system without continuing to have access to the same on-site support and resources they had at the DV shelters. So we must continue as we build on our purpose-built shelters. The design and the budgets must include adequate space for on-site healthcare and educational supports. The increase in commitment to build more supportive housing, and we must continue to commit to the homeless set-aside units in the HPD funded development projects.
Karen, you mentioned earlier rental assistance and how important you believe, and many of us believe, rental assistance is to solutions to address homelessness. New York City has committed itself to a robust local rental assistance program with resources specifically targeting families in shelter. What do you feel, because you've got a deep bench of experience in administering these programs and operating these programs, what's working in the current rental assistance approach, and what would you propose the next mayor and DHS commissioner change in the approach to rental assistance?
So George, thanks for giving me the opportunity to answer this question. Watching our families obtain, excuse me, I just need to move around a little bit. Watching our families obtain permanent housing is the reason why Help USA is in this business. We believe housing is a human right, and housing stabilization requires a network of support that provide multiple options for our families. It's a wonderful feeling to be part of a process of watching a family or an individual reclaim their independence. The reduction of the number in our system would not be possible without having the options provided through the different vouchers. I remember, again, working in a shelter, again, as you mentioned, being a residential aide and then also running and operating a shelter. We would celebrate every individual that moved out of our system because that was absolutely our goal. So the reduction of numbers, in our system, it's really why we are here. and the different vouchers, the variety that the city have provided is really a game changer for the system. I just want to highlight of note is the changes made to the city FEPS voucher. That was a huge success, and I am happy that the city listened, to the providers, listened to the community, and made the vouchers, the changes to the vouchers to meet the New York City medium rental values. The administration must continue to provide the variety of voucher options as they reflect the diverse needs of the families who utilize our systems while responding to, the gentrification of New York City housing market. Let's just be for real. It's extremely difficult for us to afford to live in this wonderful city of ours. With 35% of the adults in the family with children household employed, we have an obligation to also create pathways to stabilize employment and entrepreneurs for the families in our system. So I just want to give a quick example. Miss T, right, a 27-year-old working mom of a 4-year-old son with special needs. She came into a help shelter from a DV shelter. Miss T works nights in our system, in another DV shelter with another provider, not with Help USA. Not that I wouldn't hire her, because I absolutely would. She has support from her mom, who helps her with her son while she works at night. She utilizes the social services, the crime care coordinators, to help access early intervention support for her son and mental health counseling for herself. She's got several voucher options, right? Because she fits into multiple categories, for housing provision. So she's connected, well connected to housing. Miss T is moving with a decent amount of savings because she saved her money from her pay, and also she utilized the child tax credit and the SSI to save for her moving. As a hobby though, Miss T bakes beautiful cakes and she sells them. She bakes them at her mom's house. She's preparing to move, right? So what would it be like for us, and we're going to do this, to help and provide and guide Miss T with support to obtain either sole proprietorship or LLC to help turn her hobby into a viable business. We know that the best way to interrupt poverty is through education and through business. So all of these areas, we really need to make sure that the new administration continues or expand, homelessness prevention, educational support, healthcare support, employment, and also financial entrepreneurship. Thank you.
Karen, thank you for those insights. Thank you especially for a great case example connecting the policy discussion to how these decisions impact real people's lives. Those are powerful examples, so thank you for that. Fred, I'd like to turn to you. Over the last several months, I've noticed, and perhaps other people on this webinar have noticed, people on the subways barricaded into a quarter of the car by their belongings, something that I've not seen in New York City since the 1980s. There are large numbers of people obviously suffering from serious mental illness living on the streets of Midtown Manhattan. We can give a long list of examples of what we are seeing in terms of street homelessness. Are these things occurring? Well, let me put it this way. These things are occurring despite an unprecedented investment in targeted street outreach programming by DHS. What's going on? What changes in policy or programs would you recommend to the next mayor to address these conditions to make certain that these resources are used effectively?
So thank you, George, and thank you for that question. I'd like to start by levels. It's important to sort of understand what New York City has done well, and then to talk about what we can do better. The reality is that if you take a look at what's been happening nationally, the number of unsheltered people across the country have gone up since 2019, between 2019 and 2020, by about 7%. If you look at other large urban areas across the country and you do a comparative analysis, you'll note that the number of homeless individuals living unsheltered in California as a state is about 113,000 people. In San Francisco, in Los Angeles, you have thousands upon thousands of people living on the streets in tents. That is not our reality in New York City. And it has in large part to do with the fact that years ago, through the work of the advocates and litigation, New York established a right to shelter. And while I think that has really saved us from having the types of homeless presence that some other parts of the country have, I think it also has resulted in the system that we currently have and the way the system is currently designed. In terms of the chronically street homeless, the reality is that the thing that we've done most effectively is the introduction of the safe haven model. We operate at Urban Pathways, outreach programs. We are responsible for the outreach at the Port Authority bus terminal. We have some of the smaller contracts in Midtown Manhattan. And when I first joined the organization 17 years ago, my staff were really sort of challenged because when I would ask my outreach staff, what do they need? Their response to me was that, honestly, we need a place to put people when they indicate that they're willing to come indoors. And at that point, we had about 5,000 plus people living on the streets in New York City in the middle of January. The most recent count in New York City, I think the number was closer to about 2,700 people. So the number has actually gone down. But what my staff basically indicated was that the people who were on the street then and the people who are on the street now are individuals who have opted out of the traditional shelter. For whatever reason, and I don't subscribe to the idea that shelters are unsafe, but honestly, if that's your perception, if that's how you experience it, then that's your reality. And we have to respond respectfully to that. The other thing that we understand about this population is that many of the clients that you described there are individuals who are living with all kinds of other sort of challenges and disabilities. So that also makes them increasingly vulnerable to the large shelter settings. Our model that we introduced several years ago in terms of for the shelter system with the safe havens really is designed around small settings. We have settings that are as few as 27, 28 people. The largest safe haven that we operate is 55 units. Individuals have private rooms and or shared rooms, but there are no large dormitory settings. The fact that it's low threshold housing first, basically we were able to approach someone on the street and basically say to them, we're willing to give you a space today. We'll take you as you are. You don't need to commit to your sobriety. You don't have to commit to your mental health treatment as a condition of housing. We just take that off the table. And what we found is that when we were able to say to individuals that we're going to give them a space that they can control with limited rules, in that, we're not concerned about your curfew. You can't be involved in criminal activity in the buildings. You can't use substances in the buildings. But beyond that, you come in, you come in under the influence. We check you out, make sure that you're medically safe. We give you a place where you can rest, and we'll talk with you about it tomorrow. But we're not trying to change your behavior initially. What we're trying to do is provide you with a safe space to stay. The reality is the city's done a great job in bringing that portfolio on. However, there are not enough beds. We really need to have enough safe havens so that whenever we get an individual on the street to a point where they're willing to say yes, that person you described, I'm sure that outreach teams have encountered that person multiple times. And I guarantee you that at some point, that person will say, you know what, I'm willing to go today. I'm not going into a shelter, but if you could give me a room with a key, I don't have curfew. I don't have a curfew. You're not trying to, get me to sign a service plan as a condition of staying indoors. I don't need to do any of that. All you're going to do is give me a place to go. If you're able to do that, when the person says they're ready to go, that would make a substantial difference. Right now, we don't have enough supply to meet the demand. So that's one of the things we absolutely positively have to get done in order to effectively reduce the number of individuals that are currently on the street to a much lower number. The availability of safe haven beds. We also need to be able to provide individuals who are on the street with mental health services and assessments in a way that's going to be meaningful. So the reality is that, with the resources that we work with, the ability to have a psychiatrist or a clinical social worker who has the ability to identify someone, identify the fact that this person needs an assessment and evaluation, have them taken to an emergency room for a psych emergency, and have them admitted to the extent that they need to be admitted. That would go a long way in being able to address those individuals who are in crisis. But then we also need partnership on the city hospitals and psych facilities, in that many times we'll go through this process of getting someone who is clearly very vulnerable. And in my opinion, at imminent risk of danger to themselves, less likely others, but more likely to themselves. And we'll get them to an ER, and they'll be released almost immediately, and they're back on the street. So we have to figure out a way to sort of stop that cycle.
Thanks, Doran. You mentioned the question of capacity of safe havens, and I think many people, myself included, believe that having access to a safe haven bed when that person gets ready to come in off the street is essential. One route to increase the capacity of safe havens is, of course, to build more. And to credit where credit is due, the city has expanded the capacity significantly under this administration. But another way to expand the capacity in the safe havens is to reduce the length of stay by creating a very robust pipeline from safe havens into permanent supportive housing, which is where a lot of these folks are probably going to end up anyway. From your experience as an operator of safe havens, how do we effectively create that pipeline from, because, yes, someone should be able to stay in a safe haven for as long as possible, but the best and highest outcome is really to move that person into permanent housing with on-site support services. How do you and your team make certain that that pipeline is working properly?
Well, it's interesting. I mean, the reality is that the length of stay in the single shelter system is around 475 days. The average length of stay in our safe haven is about 150 days. So we're doing a much better job of getting people, once we get them indoors, we are able to engage them in a very significant way. The other advantage that our clients have, typically these are individuals who qualify for supportive housing. So you have some folks in the single system who are general pop, who don't have the special needs, so their ability to get access to the subsidies is a little more challenging. So our clients do qualify for supportive housing placements. There clearly aren't enough of those beds available. So one of the things that the city and the state could do is to really sort of address the flow. So we operate, in addition to our safe havens and our permanent supportive housing, we also operate several licensed supportive housing programs that are funded through the Office of Mental Health. Well, the reality is that those programs, again, small, lots of on-site services, much more intense than you'll find in a community supportive housing setting. However, when a client is no longer in need of those, the intensity of the services that are available, they don't qualify for the next step. They are no longer chronically homeless. So if we could get the city and the state to agree to allow those individuals who are in the licensed facilities to move seamlessly into scattered site supportive housing units and or permanent supportive housing units, and free up opportunities in the licensed facilities, that would go a long way in increasing capacity. And it doesn't require you to to create new supportive housing programs. It just requires you to allow there to be a more natural flow so that people can progress based on what their service needs are.
Thanks, Fred. The homeless services sector workforce has performed heroically over the COVID-19 pandemic. And you, if I may call you out for this, have been one of the most articulate spokespeople in our sector for calling attention to compensation and other supports for the workforce in our sector. Are case managers, housing specialists, porters, other staff in the sector adequately compensated for their highly demanding jobs? What's the magnitude of the investment required, do you think, to achieve equity? And do you think that increasing compensation will lead to better outcomes, less turnover amongst our staff, better career ladders for the folks who work for us, and perhaps ultimately even better services to our clients?
Yes to all of the above. The reality is that as the CEO of this organization, I don't bring anyone indoors. I don't provide counseling to anyone. I don't, help them fill out their housing applications. I don't help them make that transition. The individuals who are doing that work are the people who are on the front line. So the outreach workers, the people who are managing the front desk. We make sure that we provide, hot, nutritious meals in all of our residential programs. So the food service staff, the maintenance staff who take care of our buildings are essentially important, critically important to establishing a therapeutic environment in which people can begin their recovery. They are grossly underpaid, grossly underappreciated. And if nothing else, the pandemic really shined a very harsh light on that reality. While many people, many New Yorkers were safe in their homes, sheltering in place, ordering food as takeout, our employees were on public transportation. They were going to work every day. They were on the street, engaging the chronically homeless people who were much more visible because nobody else was out there, during the height of the pandemic, bringing them indoors, putting themselves at risk, many of them for $16 to $17 an hour. It's just unconscionable. And the reality is that the city and the state can do better. On average, a person working for Urban Pathways with an undergraduate degree as a caregiver will make about $20,000 less than their counterpart doing the very same job with a high school diploma in many cases, working for the city or the state. At this point, it's really a time for us to acknowledge the fact that it's not just unfair, but when we start talking about, social and racial justice, we know who this workforce is. It's mostly women. It's mostly people of color, Black and Hispanic, who are doing these jobs and who are grossly underpaid. So as part of the Human Services Council of New York, we put together a study involving members from philanthropy and from the academic community and researchers. And we came out with a study that really sort of looked at the economic imbalance and also made some really, clear recommendations as to what we can do. So we're demanding that the base salary, the entry level salary, someone doing this work, is no less than $21 an hour. And that we have to do a much better job of creating career paths and opportunities for people once they come into this profession so that they can continue to grow and take care of their families. I was looking at something that was done by FPWA, and they were talking about what you need to earn in New York City in order to live comfortably. $21,000 a year, an hour, it doesn't even get you close to that. I think FPWA's number is more like $80,000 for a family of two. But $21,000 takes you out of poverty. Right now, 15% of our workforce qualify for food stamps. If you include those individuals who are working in child welfare and child care, daycare, it's 25% qualify for public benefit. We can do better. We have individuals who are working in this industry who are in shelter themselves because they can't afford housing. So it's time, and yesterday was the kickoff of the Just Pay campaign. I'm sure if anyone on this Zoom hasn't gotten the emails, you should be being bombarded by them. We're asking you to sign on to the campaign. We're asking you to review the material and to get actively involved in moving this agenda forward.
Fred, thank you very much for those insights. If I may turn to Rangi. Rangi, if you were given the opportunity to have 30 minutes with the next mayor to discuss ways to end homelessness in New York City, what would be your top 3 proposed solutions? And can you tell us, it doesn't have to be 3, it could be 2, but and tell us why you think each one of these would be successful.
Well, first, thank you for this opportunity, though. it to revisit what was a markedly painful part of my life. But I hope that in doing this, that I will gain some closure and both also just give some insight to what it was. I was abruptly interjected into homelessness. My house burned down. I came in one day, it was on fire. Everything I owned was in the apartment, and it, including my dog. And so that I had nothing. The Red Cross came, and then I went to a hotel, and then 2 weeks later I was on my way to a shelter. And I feel the first thing is the intake process. I showed up and I've got everything I owned left that I'd acquired between the fire and there's this long line, and none of the questions posed to me seemed to be relevant to my experience, because I didn't have a drug problem. My mental health needs weren't so great. I felt like I was in this sort of weird in-between space that I didn't, even when I was standing at the intake, the guy said to me, "What are you doing here?" And I said, "Well, my house burned down." And he said, "I mean, you must have somewhere else to go." And I'm like, "Well, if I did, I would have been there." So I felt like the process of sitting down with each person and trying to figure out where that person ought to go based upon his or her needs, which is different than you are male, you are this age, and we'll send you to this shelter and so I felt, because I had a job that I had to get up. And I remember the first shelter, I was one of, I think, 36 people in one large room, and there were a series of cots, and so going to bed and going to sleep and getting to work on time became a problem, because I was the only person who in that section who had those responsibilities. And so that was one thing. I thought, like, well, what if it was more individualized? What if someone could say to me, "Rangi, this is what you ought to do. This is your path forward." That would be important, I think. And also having mental health care in each shelter, because I was a mess. I didn't know up from down, left from right. I was overwhelmed. Homelessness felt like somehow a personal character flaw. Like I was like a failure of my person somehow. And there's a difficulty in that I had not anticipated. And so if there had been someone I could have talked to about that, that would have been helpful. But there was no one. And I think that is the most important thing, because if someone had said to me, I could help you. Great. But I didn't feel that was an option. In fact, at some point I was in the shelter and someone like tried to assault me, and I went down to the front desk and I said, I told him what had happened, and the clerk said, "But you're gay, aren't you?" And I thought, like, this can't be happening. This can't be my life. And so I think mental health services, and to tie it, and I think there'd be a great, if you paid people more. I mean, I think by the time that I was done, I thought, like, you are 22, you're making $12 an hour. This is hard work. This is hard work. You ought to be trained. You come in every day, and you should be paid more. There should be a way for you to the staff to be supported, so that you can then support the people who are coming in. But if you're not supported, if you are living hand to mouth and then coming to this job, which is overwhelming, then you don't have anything to give. You are just trying to make it, and you can't. If you've got nothing and I've got nothing, then you can't make it's not better. There's no way for it to be better. And so I thought, well, if you paid people enough to come and be invested, or had enough money to hire people who were invested, then the entire system improves. Because then when I show up, then someone can say to me, "This is what we can do for you. We see who you are and we can help you." But if the people who are working there are And sometimes I show up and I'm like, you've been here every day, all day for 3 days. Of course you're tired of this. Of course this idea of being here is burdensome because I don't want to be at work for 3 days. And so I thought like, well, there's nothing, what can be done if we continue to get people who have to have a job and they have to take this job because they need a job and are not interested in the work. And then the pay that they receive is so low that you can't give what you don't have. And so I thought, yeah, and maybe that's the most important part. Maybe if you started with paying people more, that all the things that I found to be harmful or devastating about my experience would not have occurred, because there would have been, the system would be populated with people who have chosen this as a profession, who feel validated in their work. And then they are able to then move forward in a way that is positive, and they can look at me and say, welcome, and we can help you, as opposed to this is one more person I'm going to have to look after during my shift.
Rangi, thank you. It is a real privilege for us to have access to your experience, and we're very grateful that you feel comfortable sharing it with us. And it's our responsibility to act on some of your excellent suggestions. But I do want to thank you for being willing to talk to us today. Let me ask another question. Many of those of us who work in the not-for-profit world, the organizations represented, for example, on this call, we create opportunities for input from consumers of our services. We engage in initiatives like consumer advisory boards and consumer surveys, and these things provide us with insights, helping us to be more effective in our work. Should the next mayor and DHS commissioner create comparable forums to hear directly from the people using homeless services in New York City? And would input from people with lived experience make the city's efforts more successful?
Well, I feel like the problems that exist in the system are not client-based. I mean, it's not the result of an disengaged or client-based. I feel that how does a commission not be a fig leaf, I guess is my question. And so that, I don't know, and I think the other problem is recruitment. I mean, I'm teaching this class and this writing workshop at the center on 52nd Street, and I needed to make take photographs for my contract, and so for advertising. And these women who come to the class every day, they participate. When I said, may I take your picture, suddenly the mood changed. And then it was, okay, you can take my picture, you can't use my name, or I have to wear my mask. I don't want anyone to know who I am, but I want to take this picture so that you can fulfill your contract. So I think there's part of it would be the recruitment, like who wants to stand up? Like I considered not doing this as recently as 8:17 this morning, simply because I thought, like, do I want to be that person? And then my sister said, if not you, then who? And I thought, yeah, like exactly. If not me, then who? And so I think that recruitment in the commission would be a difficulty, but also what benefit? Like if I'm going to stand in front of the world and say I'm homeless and these are the terrible things that happened to me, or these are my suggestions, and then when do I expect the turnaround? Like at what point will it be different? What point will it not be necessary for someone to have a commission and ask homeless people, people who are experiencing homelessness, what they feel about the experience? Of course it's terrible. Of course no one wants to be in a shelter. So it seems that the problem is higher, it's political, it's administrative, it's something, but not some problem that can be solved by the people who are receiving the services, because those people, if given their druthers, would immediately not be homeless. And so I feel like the problem happens above us, and we then receive the resulting complication. But I don't know what it is we could do, and what I would say that someone else hasn't already said. I mean, I feel like there is a wide body of evidence and testimony from people who are living the experience every day. And if that has not yet changed something, then my voice, it's certainly not my voice, because I am the outlier. My experience in the shelter, the system was, I was like a unicorn only because how would I end up there? Everyone, that was always the question, like, what are you doing here? And just the idea, and the idea that I was poor, like that was all. And so it wasn't really enough to get help. Like I was poor. I didn't come to prison. I didn't have a drug problem. I was just poor. And it seems like the system doesn't have a mechanism to help someone who's single. And I didn't have a baby or an elderly mother to care for. I was a single man who was poor. And it doesn't seem to be a mechanism to help someone who's poor, which seems crazy.
Thank you for that. That's a perspective that I think needs to be heard more frequently by those of us who do this work. So that's a really important insight, Rangi. Thank you for that. Let me also ask another question. As shelter residents were relocated to commercial hotels during the COVID-19 pandemic, a number of neighbors of the new facilities reacted very negatively to their placement in their community. And the whole NIMBY problem, we're all painfully familiar with. What message, as someone who has used the shelter system, what message would you deliver to community members who fight against shelters or other programs to address homelessness being placed in their backyards?
Well, by default, I find it offensive, the idea that I have to make other people palatable to other people. Like the idea that I somehow, because I mean, if you're despicable, you ought to have a place to live. You don't have to be a God-fearing good person to deserve housing. And so I think the problem, and so the idea that like, it's like making, making white people like black people. I don't care. It's like, I don't care if white people like me, but I feel like there should be a structure, perhaps governmental, that then says, these are the number of shelters we're going to have. They're going to be evenly divided throughout the 5 boroughs. And we're going to make sure that they're located in a variety of neighborhoods. Because I feel like waiting for people to do the right thing, like what sort of lipstick do you put on the pig to make some not quite liberal enough Upper West Sider want to live with a shelter next door? Because there's no way, I don't think there's a way to build a shelter and then populate it with people who the neighborhood's going to find palatable. Because they won't, yes, there will be smoking and they won't wear the clothes they want. So I think, well, how do you do that? I don't know that there is a way to do that, because without the people in the shelter feeling like somehow they're tokens, like if they're to be respected as people, then how do you then present them in a way that is then they're other than what they're currently experiencing? So it's like, if I have to dress it up, or if they are all college educated businessmen who fell on hard times, that'd be one thing, but that's just not the reality. And so I think that in the way that I don't know that it's possible, really. I mean, what I would say is get over yourselves. I mean, I would say that like what your responsibility, we have this responsibility to one another, so that you give up a little, I give up a little, and then we all are better. That's what we're doing. That is the process in which we are engaged, so that how your property values are less important than this person having a place to sleep. Like but I think that moment has passed. Like that is not the America in which we live. That is not, those aren't the values and some of those people were my friends, like people with whom I'd gone to college, and suddenly they're all up in arms about homeless. And I thought, like, who are you? Like, where have you been? Like, and even they're like, but of course we're not talking about you because your experience was different. And I'm like, no, it wasn't. Like, I was equally homeless. Like, there's no degree. Like, it's like being pregnant. You're either homeless or you're not. So it's not like I was somehow less homeless than the guy who had schizophrenia. Like, no, I was that guy. Like, my experience was exactly his experience. And so I think that it should be a larger, there should be a policy change or something, because waiting for people to do the right thing is not, it's just not going to happen. I mean, there would still be segregated schools if we were waiting for people to do the right thing. You know, women would still be unable to vote. We're waiting for people to do the right thing. It's like gay marriage, all those things that are important that we changed. It's not, there was no waiting for people to do the right thing. It's like, this is the right thing, and therefore you must adhere to it, because it's best for everyone. And you can't get everything you want. I can't get everything that I want. But that's just how it works. And we all give up a little something. And I love no one more than I love myself. So I'm not like, but I realize that my reality is not the only one that matters. And so I think that particularly when it comes to economic issues, because what are you going to do? People need houses. I needed a place to go. But for my friend giving me a set of keys, like the day that my friend Michael gave me a set of keys to go to his apartment, that day I decided I could not go back to the shelter. I was like, if I have to throw myself in front of a train, I am not going back to that shelter. And that day he said, take these keys. And my life changed, like in that moment. But for him.
Rangi, thank you so much for this presentation this morning. It's really been very powerful, and you know, it's obviously not easy for you to talk about these things, and we are the beneficiaries of your finding the courage to do so. So thank you very, very much. I'd like to turn to Felipe. Felipe, the homeless services system in New York City doesn't exist in a vacuum. Shelters and, unfortunately, the street homeless population are frequently swelled by feeder systems, jails, prisons, hospitals, the foster care system. What should the next administration do to address this problem? How optimistic are you that the feeder systems and the Department of Homeless Services can jointly develop effective diversion programs to avoid folks being discharged from institutions ending up in shelter or on the street?
First, George, thank you for convening this panel and certainly for inviting us to be a part of it. And Rangi, thank you so much for sharing your story, having the courage to do that, which educates all of us and helps us inform this discussion. Yes, the systems you described, the jails, the prisons, the hospitals, and foster care, they're certainly all feeders, not just for the shelter system, but for street homelessness. I think what is needed is a bigger investment in transitional housing. And I know that in recent times, that word, right, beginning with HUD defunding transitional programs in favor of permanent housing, it isn't a popular concept as of late, but I think the issue is that it has always been looked at as we need to invest in permanent housing and not transitional, or transitional and not permanent. No, we need to, particularly here in the city of New York, right? We have a severe shortage of affordable and supportive housing. So we need to do that, but we also need transitional systems. For example, someone being released from a hospital undomiciled. You know, I was listening to Dr. Doran speaking earlier, shouldn't be dropped off at 30th Street and have to deal with all of that. And then they find some appropriate setting, right? An appropriate with a small a. And that's not to bash DHS. We're partners with DHS. We think they've done a wonderful job. Many of the panelists have said it, in reducing the number of homeless folks. But what we really are talking about, or what I'm talking about in my organization, is creating specializations. For example, someone coming out of the state prison system that has served a prison sentence, instead of going to shelter, they should go into a transitional facility. We, shameless plug here, we actually operate one in Brooklyn, a 400-bed facility, and we have parole officers on site that do the guys that come out. They're able to have their visits with the parole officers. We employ them transitionally. We pay them to work. We provide them with educational programs. We provide them with occupational training. And in partnership with Care for the Homeless, we have a clinic on site which addresses their mental health, their medical needs. We place them in employment. We place them in housing, right? These are the type of transitional systems that we're talking about. Earlier, I heard Fred Shack talk about the safe haven. I would consider that a transitional system from street homelessness, right, into having your issues addressed and transitioning into permanent housing, more likely supportive, but some folks can work themselves out of that. We also heard him talk about the issue that exists, which they can't go directly from there to permanent housing, right? So we're talking about creating transitional programs and transitional systems that adequately address what people experiencing homelessness at that point, whether discharged from a hospital, discharged from a city jail, or from foster care. We have a situation where a child, through no fault of their own, is in the foster care system. They turn 21 years old, they don't have a place to go. How could we allow them to go into shelter? What happens? No, there should be some transitional place where they could go. They could focus on education, self-development, and other things that they're going to need to be functional young adults that get a job and become contributing members of society. So again, what is needed is that bridge, transitional type of programs for jails, for prisons, for hospitals, and for the foster care system. How optimistic am I that this can actually happen? Can DHS be a part of that? As I mentioned before, and other people on the panel have mentioned, DHS has done some good things around reducing homelessness. So they can be a part of that. Can it be addressed? Yes, absolutely. If we didn't believe that it could be adequately addressed, we wouldn't be doing this work. What we need is the focus, the resources, and the will to do it. Thank you.
So Felipe, you and your colleagues have been pioneers in this particular model. I mean, you're making the case for the need for this program. Talk a little bit about the outcomes you've achieved. What are you seeing with respect to people achieving self-sufficiency after they leave your program, people recidivating back into the system? What are you seeing in terms of outcomes?
Yeah, so I'd like to begin a little bit by putting a little more meat on the bones in terms of our model. So we've been around over 30 years and we have 661 beds under contract with DHS. And those are shelters technically right under contract, but we consider them, what I mentioned before, transitional residences, where we provide paid transitional employment. We employ people immediately, transitionally at $15 an hour. We provide them with educational program, everything from basic adult education all the way up to high school equivalency. Some folks go on to go to college. We provide occupational training, things like culinary arts, CDL training, pest control licensing, and most recently, we're very proud that we just launched the carpentry program, and very soon, in the beginning of this year in January, we also have a welding program. So after we provide those programs, then we place people in employment. We then place them in housing. Last year, because of the challenges of COVID, we placed 193 people in jobs. We usually place in the 300 level, but last year, because of COVID, that's where we landed with jobs. We placed 270 people in housing. The 6 months retention rate for those jobs is 76%, I'm sorry. The average wage is about $17 an hour. In terms of our recidivism, which is really the mark that people use to measure folks coming out of prison, right? That's what they use. They don't use jobs. We should have a focus on that, but that's not the way that things are. What they measure is the recidivism rate. So the recidivism rate for people coming out of the state prison system over 3 years is about 2/3 of the folks go back. We reduced that recidivism by 62%. These are figures from 2018, and that's on top of some recidivism data that we had from 2010 in a study done by Bruce Weston, a renowned Harvard professor. Most recently, we partnered with New York City. I don't know if you've heard of the City Cleanup Corps, which is an initiative to create 10,000 jobs, to beautify the city of New York and jumpstart the economy. So thank you.
That's very helpful and great data, Felipe. So you guys exist kind of post-discharge, right? That's you're taking people who are coming out of the institutions and getting them back on their feet and helping them become more self-sufficient. From your experience, is there more we could do upstream, so to speak? So is there more that we could do within a correctional institution, for example, to help someone have a greater likelihood of self-sufficiency once they get discharged?
Yeah, there actually is a lot more that can be done in the state prison system. And they're around some of the issues that I just mentioned. We can have better educational programming there. I mean, just to give an example, a lot of the folks that wind up in prison have many different issues, but one of those issues, there's a significant portion of the population that have learning disabilities. And for someone going into the state prison system, if they're 21 or older, there's no assessment for that, right? So you can have someone serve 10, 15 years and be in school and not advance a grade because their learning disabilities were never assessed and they weren't given the proper instruction. You also, so that's if you're younger than 21, that happens and you get the right services and that sort of thing. Also, better occupational training. For example, across the country, we hear of all the industries, trades in particular, where there is a shortage of skilled laborers. I mean, as of late, because of the Christmas season that's coming, we hear that there's a shortage of CDL drivers in the 80,000 range, right? In addition to all the problems with the ports, but so CDL might sound a little crazy to some people. CDL, these guys are in prison. Actually, there was a CDL training program in Otisville Correctional Facility that was cut in the early 90s when they had the crime bill with the Clinton era and along with a lot of other programs like higher education, and corrections has recently done a really good job with bringing back higher education. But that initial cut for TAP and Pell for those programs don't exist. So a lot can be done, in other words, up there. And then the last thing I wanted to mention, more needs to be invested in therapeutic approaches to helping individuals deal with the issues that they have when they're presented before the justice system. And in many cases, those issues became exacerbated, right? When they go into the first Rikers and then upstate, and I mean, we're all familiar with the story. So more needs to be done to address those things. What can the city administration do directly? As is laid out now, that's a state function. So they wouldn't directly be able to do anything other than to leverage their political capital to influence policy so that more can be done about that. And also to create funding for an investment for programming so that when people come out, they have the appropriate services delivered to them so that they're better able to adjust. And we can take one of the things up until recently, right? Because there's been a lot of, through the pandemic, now we see spikes in gun violence. But up until recently, particularly in New York, everyone was applauding the reduction in all the different crime categories, right? And those were realities. But one of the areas that we really need to focus on is folks coming out of prison, because I always like to say that's the final frontier in public safety. Most people that go back into the system have been there before. So if you do a good job to help people when they're there, everybody wins, everyone wins. But that's something that we really, really need to focus on.
Thank you, Felipe, for those insights. Very, very helpful. We have a few remaining moments in which we can take some questions that have been presented by folks in the audience today to our panelists. Let me start with a question from Joshua Goldfein from Legal Aid Society. Josh, thank you for joining us today. Josh asks, to what extent is the decline in the family shelter census the result of access to increasing counsel in housing court, which was one of the initiatives of this administration. And how does that relate to the various eviction moratoriums that were put into place during the pandemic? What's going to happen when evictions resume? Anybody on the panel want to take that one on?
I'll take that one on.
I thought you might.
Thank you, Joshua, for the question. That's a really good question, and one that we in the system have been preparing for. First, in the beginning of the presentation, I talked about the decline in families. Homelessness actually predates COVID, right? It predates the moratorium. So that decline was already starting to occur in the families with children system. But now we have several opportunities to engage families and systems in advance. We have the Emergency Rental Assistance Program, ERAP. That's it's a citywide, borough-wide. Actually, it's a statewide initiative. Help USA. We operate. We're part of a consortium in the Bronx that's able to reach out and assist individuals in advance, letting them know about the access to the funds to help prevent homelessness, focus on our home-based programs. That again is a citywide initiative throughout the city. There's a Project Parachute that we also are a part of in terms of having funds available to, and this is a consortium of landlords, and real estate individuals that pulled some $1 million funds, and is being operated through enterprise. And we are one of the organizations that is able to administer that money. There's a huge campaign, there's a huge push, there's a lot of information available, that's going to help individuals not enter the shelter system. And then again, even also in the shelter system, if someone happens to have to go that way, there's still diversion programs within the family shelter system that can help provide rental systems, vouchers, support to try to help connect people back to stable housing. So we are really, the entire sector, all of the providers, we're really full throttle in trying to make sure that we do not see the numbers increase in the family with children system by providing all of these options for rental assistance.
Thanks, Karen. We've had a couple of questions that kind of move around a similar theme, including one from Care for the Homeless board member Philip Malebranche. And the theme is, are we living in a situation where the right to shelter is kind of privileging the shelter system as a solution to the expense of other systems? And Fred, I'm wondering if you have, I bet you've thought about this a lot, and we'd love to have your insights on this.
Absolutely. And I appreciate that question. Honestly, the right to shelter was really critically important in its time, but I think it's time that we evolve to a right to housing. Housing and homelessness in New York City is it's about the economics. There's a disconnect between what people have available to them and what housing costs. And government has a responsibility for bridging that distance. So really, right now we spend about $3 billion, give or take, on the shelter system. I can't imagine what we could accomplish if those dollars were able to be redirected to making additional subsidies available, creating and expanding the affordable housing portfolio, and addressing it that way. So I think he's absolutely right. It's time for a shift. And hopefully, what I've heard from the candidates during the campaign was a commitment to really investing in deeply affordable housing at 20 and 30% of AMI. So individuals who have very limited resources will still be able to afford decent housing somewhere in New York City. If you work in the city, you should be able to live in the city and afford to live in the city decently.
Thank you, Fred. I know all of the participants in our webinar today thank this extraordinary panel. We've learned so much from each of you, and really a heartfelt thank you for taking the time, giving all these questions some thought, and sharing with us your very valuable perspectives. I'm going to take a moment to ask two things from our participants. One is that we're going to pop up the poll that we talked about earlier to see if people's perspectives have shifted. And also, I ask everybody who has participated in the event this morning to complete the survey. We truly take these responses into account as we plan future policy webinars. Please make certain you're connected to our various feeds so that you're getting announcements of our different policy and advocacy events. We've got the Homeless Person Memorial event coming up in December. We invite you all to join and participate in that. That's a very important point in the year for all of us to sit back and remember the folks who have passed away in the last year in this situation of homelessness in New York City. But thank you all to the panelists, and thank you all to the participants who took some time this morning to spend part of their day with us. We are really grateful, and thank you all for joining. Have a good day.